All right, so the first thing we're going to check is the physiological range of motion, which is basically seeing if the first rib releases a little bit or drops down when we take off the stress of the scalenes pulling on it, all right? So we've already evaluated the posture, and we have either our first rib profile or our scalene profile, and then anyone could be anywhere in between that as well. So palpating the first rib can be a little challenging because there's a lot of thick overlying tissue, and we're really palpating it indirectly. So we're going to locate the traps, we're going to get behind the SCM, we're going to kind of fall into that little groove right in front, and we want to use a very flat contact. So I have my second and third digits, you can add your third digit in there and just press into the tissues over the top of the first rib. All right. And press comfortably down and compress the tissues, but not so hard that you are diminishing your sensation to feel the first rib move away from your fingertips. So from here, we'll contact the patient's head, we'll retract a little bit, we will laterally flex towards and a little rotation away, and you'll feel the first rib kind of lift ever so slightly away from your fingers as it goes down. And that's physiological range of motion. While I'm here, I'm going to follow through with the next procedure, which is joint play. And as you know, joint play is adding overpressure to the movement. So we're going to start out the same way. I have contact over the top of the first rib, and I securely hold on to my patient's head and laterally flex towards the side and slightly rotate away. And now I follow through with both hands to assess how much resistance is there. Is there a springy sensation to it? And I note what it feels like and remember it to compare it to the opposite side. And then I will go to the opposite side and perform the same procedure. All right. And I can actually feel those tight scalenes there. You feel those coming down?
Yep.
All right. And make my contact comfortable. First thing I check is just physiological range of motion, no overpressure, so a little bit of retraction, lateral flexion towards, a little bit of rotation away. And then I follow through with my overpressure. Now by comparison, the right side does not have as much joint play as the left side, but I didn't appreciate that until I finished both sides.